Bismillahirrahmanirrahim. I'm Dr. Javed Iqbal Kokar, Professor of Forensic Medicine and Toxicology. As I'm discussing personal identity, and this is the 25th lecture of this series, and continuing the examination of teeth regarding age, now I'll discuss what other information we can get from the teeth. And the contents of the talk will be that which are the informations which we get, they help in identity by the help of dental charts, by the help of dentures, and the teeth bite marks also give a very valuable information regarding identity. Then it can help in determination of sex. It can help also in blood group estimation or determination. Lip prints, they are also helpful. Age can be found out from the mandible. So starting with the topic, first identity from the teeth. The determination of identity from the teeth is basically based on the fact that the teeth and the dentine filling have definitive shapes which are also specific to each individual. Their arrangements, their development, their shape, their dentine filling, all are specific to each individual. And the people sometimes when they pay regular visits to the dental practitioner, the dental practitioner keep a record. When during the treatment they keep a dental record in the form of dental charts. So the dental charts which are prepared at the time of examination during the visit to a dentist, the inspection of teeth and comparison with that dental record which the dentist has prepared in the form of dental charts becomes an important document, especially when a person is found dead regarding its identity. And this is the type of dental chart which the dentist prepare. Now the identification can also be made from dentures, and this is with the help of dentures, whether it is partial, it is complete, and it is present in the upper jaw or it is present in the lower jaw, then from the mark of the teeth, also from the type of mold and other technical details about that denture will help us in identity. Now the identification from other data like bite marks. Bite marks are very important in physical assaults, sexual assaults, or other medical legal offenses because every individual has very specific tooth imprint, and similarly the bites, when human bites is on another human, they make a very specific character and pattern which is unique to that individual. So that's why the bite marks are important. And on the examination of clothes and underneath skin, especially in cases of physical and sexual assaults, and also on the food stuff, sometimes the person is eating something, apple or fruit or anything, and leaves at the scene of crime, and there's cut marks by the bite of the tooth are also specific, and it acts as a very good evidence for personal identification because the impression of anterior teeth should be compared with the test bites. So the people, a person under suspect should perform the bite and it should be compared with the bite which is present at the scene of crime. So this is a pictorial diagram of a bite on the forearm of the individual, and this is a diagrammatic representation of a model, and you can see the pattern and the imprint of the teeth on the bite mark. And this is the examination under process, how we examine. Then the distance of the piercing teeth and they are compared with the suspected individual. Then the teeth can also help in sex determination, and this is done by the Y chromosome from the pulp of the tooth, which is fluorescent to the quinacrine dye. Then the blood group substances, they help in identification, because we know the blood group substances are determined from the fragments of the teeth or the salivary secretions. Secretants, the individual who secrete their blood group substances in the saliva, they can be found out from the salivary secretions. Then the lip prints are also important. They are not related with the tooth examination, but lips are also, because no two persons have identical lip prints. Every individual has unique identities in every aspect. Look, the lip print is specific for particular individual, and this gives a very valuable information, as valuable as fingerprints. Then the age from the mandible. The mandible, it can tell us about the age, young age, middle age, old age, eruption of the teeth, the resorption of the alveolar ridge, or the presence of the alveolar foramen where it is placed. So, age changes in the mandible should be studied in relation to the shape of the bone as a whole and its various parts, like ramus, condyloid process, and coronoid process. Their shape, their style, their angle, they help. I have discussed in detail in previous lectures. You can go through them. Then especially the dentition, primary dentition, secondary dentition, tooth falling off. Then about the alveolar ridge, it is reabsorbed in old age. Then muscle attachment and the position of the alveolar foramen, it is important. The alveolar foramen in the child, it is at the lower level. In the middle age, it is in the middle, and in the old age, it is at the upper border. So this is a picture. The upper one, mandible, where the foramen is in the middle, it is of the middle-aged person. Whereas the lower one, the alveolar ridge has been resorbed, the foramen is at the upper border level. And this is an X-ray showing the foramen, mental foramen in the middle. So thank you very much. This is all about the tooth examination, and we'll continue the personal identity topic in the next. I'll be discussing sex determination. What are the parameters?